Pneumonia, an acute infection of the lungs, poses a significant health threat, particularly to vulnerable populations. This inflammatory condition, often triggered by bacteria, viruses, or fungi, affects millions globally. Pneumonia's impact extends beyond mere discomfort, potentially leading to life-threatening complications. Understanding the nuances of pneumonia nursing care is paramount in combating this silent threat. Nurses, positioned on the front lines of healthcare, play a pivotal role in managing pneumonia. Their expertise in assessment, intervention, and patient education is crucial for positive patient outcomes. This essay delves into the multifaceted realm of pneumonia nursing care, emphasizing the importance of a holistic approach. From accurate assessment to tailored interventions and comprehensive patient education, each step in the nursing process contributes to effective pneumonia management. This essay serves as a guide for nurses, equipping them with the knowledge and skills to provide optimal care for patients battling this respiratory illness. The primary objective in pneumonia nursing care is ensuring adequate oxygenation and ventilation. Pneumonia disrupts the lungs' ability to exchange oxygen and carbon dioxide efficiently, leading to respiratory distress. Nurses play a critical role in maintaining optimal respiratory function in these patients. Assessment of respiratory status forms the foundation of care. This involves continuous monitoring of vital signs, particularly oxygen saturation levels, respiratory rate, and effort. Observing for signs of labored breathing, such as nasal flaring, use of accessory muscles, and cyanosis, is crucial. Interventions aimed at improving oxygenation and ventilation are paramount. Oxygen therapy, administered via nasal cannula, mask, or mechanical ventilation, is often necessary. Nurses titrate oxygen flow rates based on continuous assessments and physician orders to maintain target saturation levels. Positioning the patient in a high Fowler's position can also facilitate lung expansion and improve ventilation. Effective pneumonia care hinges on accurate and comprehensive assessment. This involves a multifaceted approach, considering the patient's age, medical history, and individual needs. A thorough physical examination is crucial, focusing on auscultation of lung sounds. Nurses listen for adventitious sounds such as crackles, wheezes, or diminished breath sounds, which can indicate lung consolidation or airway obstruction. Assessing the patient's cough, sputum production, and chest pain provides valuable insights into the severity and progression of the infection. Beyond physical assessment, nurses must consider the patient's psychosocial well-being. Anxiety, fear, and discomfort are common among pneumonia patients, impacting their overall recovery. Recognizing and addressing these concerns through empathetic communication and emotional support is essential for holistic care. Section 4. A multifaceted approach. Interventions for pneumonia. Managing pneumonia effectively requires a multifaceted approach, encompassing a range of interventions tailored to the individual patient's needs. Airway clearance techniques are crucial in mobilizing and removing secretions, promoting effective breathing. Nurses encourage deep breathing exercises, coughing, and incentive spirometry to facilitate airway clearance. In some cases, chest physiotherapy, including percussion and postural drainage, may be necessary to loosen and remove thick secretions. Hydration plays a vital role in thinning secretions, making them easier to expectorate. Nurses encourage adequate fluid intake, often setting target goals based on the patient's individual needs. Monitoring intake and output helps assess hydration status and adjust fluid management accordingly. Section 5. Tailored care. Addressing unique patient needs. Pneumonia care extends beyond standardized interventions, requiring tailored approaches for patients with specific needs or conditions. Patients with dysphagia or difficulty swallowing are at risk of aspiration pneumonia. Nurses implement strategies to minimize this risk, such as thickening liquids, adjusting food textures, and ensuring proper positioning during meals. Close monitoring during feeding is crucial to prevent aspiration. Ventilated patients require specialized care to prevent ventilator-associated pneumonia, or VIP. Nurses adhere to strict infection control measures, including meticulous hand hygiene, oral care with chlorhexidine solution, and regular assessment of the ventilator circuit for any signs of contamination. Section 6. Knowledge is power. Patient education in pneumonia. Patient education is an integral part of pneumonia care. empowering patients to actively participate in their recovery and prevent future infections. Nurses provide clear and concise explanations about pneumonia, including its causes, symptoms, and treatment options. They emphasize the importance of medication adherence, particularly completing the full course of antibiotics, even if symptoms improve, to prevent antibiotic resistance. Respiratory hygiene practices are paramount in preventing the spread of infection. Nurses educate patients on proper hand hygiene, cough etiquette, like covering the mouth and nose when coughing or sneezing, and the importance of avoiding close contact with others while contagious. Section 7. Navigating recovery factors influencing outcomes. Recovery from pneumonia varies depending on several factors, including the patient's age, overall health status, and the presence of any underlying medical conditions. Elderly patients, due to age-related decline in immune function, are more susceptible to complications and may require a longer recovery period. Comorbidities such as heart disease, diabetes, or chronic obstructive pulmonary disease, also known as COPD, can also impact recovery and increase the risk of complications. Nutritional status plays a crucial role in supporting the immune system's ability to fight infection and promote healing. Nurses assess patients' nutritional needs and provide guidance on maintaining a balanced diet rich in fruits, vegetables, and protein.